In other news, the BC Centre for Disease Control now says a third child has died in the province due to complications linked to influenza. This news comes as BC and the rest of the country navigate respiratory illness season with cases of flu on the rise from coast to coast. Trissa Kindelman is on this story for us this morning. So much concern for not only families, but those with young children hearing about these deaths. So what is the latest on this?
Yeah, absolutely. So the situation in BC, where we're going to start at this point, both kids that died earlier in December were under the age of 10. We learned this week that there was a third death also in that same age range under the age of 10. So it means that influenza was a contributing factor to these deaths. Doesn't necessarily mean that this is what the children died from, but it was a part of it. It could also mean that there were other illnesses at play. Secondary bacterial infections are also common with a weakened immune system given an influenza infection. So now this is a rare event, according to the BC Centre for Diseases. They are saying that given the young ages of these children, they will be investigating and looking into the circumstances. But again, given the rise in the numbers that we're seeing, not only in BC, but across the country, definitely a concerning situation for parents and a number of people. Next door in Alberta, it does show that 80 people have died from the flu there this year, the youngest in the 30 to 39 category. If we look at a national picture this week, the latest influenza data that we have is from the first week of December. We are expecting to see later today 3 weeks worth of data nationally, which will help to paint a better picture of what's going on during this influenza and RSV season. But so far in that first week of December, there were more than 4,300 lab-confirmed cases of influenza across the country. I know we heard so many different people over the holidays canceling plans, making different plans, adjusting to illnesses. So it's definitely a situation that we'll be keeping an eye on. Again, later today, we'll get 3 weeks worth of data, give us a really good picture of where things are at currently across the country.
Yeah, an interesting snapshot. So we'll keep a close eye on that. Thanks so much for the update, Tricia.